I'm Elizabeth Griffiths. I'm one of the leukemia physicians here at Roswell Park. My focus is on hematologic malignancies. So myelodysplastic syndromes, myelo, bone marrow, dysplastic means funny looking, and syndromes are a group of symptoms. So for most patients presenting with myelodysplastic syndrome, many people are actually completely asymptomatic. Others are referred because their doctors notice an abnormality in their hemogram or their complete blood count. Sometimes that's mildly low red blood cell counts, sometimes it's mildly low platelet counts, sometimes it's a high or a low white cell count, sometimes it's a change in the size or the shape of the red cells. All human beings are born with a set of bone marrow stem cells. Over the course of one's life, one sustains exposures. Maybe one of the stem cells in your body was dividing when one of those toxins was around. One can develop a mistake and compromise the ability of the bone marrow to do its job effectively. Most patients with myelodysplastic syndrome will have 2, 3, or 4 or more mutational events in those cells that are damaged. In order to make a diagnosis of MDS, you have to have at least 10% of the cells in the bone marrow that are abnormal looking. You can divide patients into those with lower risk myelodysplastic syndrome, those with what we call intermediate risk myelodysplastic syndrome, and those with what we call higher risk disease. And so I would argue that MDS is not a pre-leukemia, but is in fact a true cancer diagnosis. We also know that even people with lower risk MDS have a substantial risk of dying related to an MDS-related complication, either infection, bleeding, or the risk for transformation to leukemia. Considering MDS as a pre-leukemia or thinking of it as a more indolent disease really does a disservice to the patient because it doesn't take that into consideration that this is a true problem, true malignancy that has a potential to substantially impact both survival and quality of life.